Introducing the case of 17-years-old female with no systemic system reported. The patient complained to be having a subcutaneous swelling on the lower back of the left arm. In about 4 weeks, it came with a mild pain. As for the clinical examination, the swelling shown to be spherical shape, well-defined margin, subcutaneous with no redness, warmth, nor sign of acute inflammation. There are also no other swelling detected anywhere else in the body. As the cytological examination conducted, it is shown to be microfilaria identified as Wuchereria bread coffee. So, what is Wuchereria bread coffee? It is the mosquito-borne parasite that is daily with the symptom happens to the patient. So, as the patient had this microfilaria inside her body, the disease patient caught may be the lymphatic filariasis. What is lymphatic filariasis? It is a thread-like parasitic worm that transmitted to human body through mosquito bites. After entering the body, the parasite lives and grows in the lymphatic vessels. As consequences, an adult worm will block or damage the lymphatic vessel, which leads to the impaired lymph drainage. Over time, the fluid accumulated in the tissue will cause the chronic swelling.
Numerous microfilaria were identified as a Wuchereria bancrofti by cytological testing using a gemstar stick. Diethyl carbamazine is therefore the best anti-helmintic medications. This medication is a preferred treatment for the lymphatic filariasis brought on by the Wuchereria bancrofti because it directly affects the microfilaria by changing their surface membranes, increasing their vulnerability to being destroyed by the host immune system. Consequently, the amount of the circulating and tissue microfilaria is quickly decreased. Diethyl carbamazine also lessens the related inflammatory response by lowering the microfilarial burden in tissue, which resolves localized swellings, relieve symptoms, and stop the condition from getting worse.
Diethyl carbamazine is generally effective, but it may cause some common adverse effects. The first is headache, which is usually mild to moderate and may appear shortly after starting the medication. It often improves as the body adjusts and can be managed with resting. The second is fever, which may be low-grade or moderate, and sometimes comes with chills. This is generally temporary and occurs as the body reacts to dying parasites. The third is nausea and vomiting, which may appear shortly after taking the drug. This can often be reduced by taking the medication with food. In some cases, metoclopramide may be prescribed to help prevent nausea and vomiting. Overall, the side effects are usually mild, but patients should report them if they become severe or persistent.
According to my research journal, I found that the most of African at-risk population live in countries that also endemic for oncorariasis, where annual ivermectin plus albendazole is the recommended mass drug administration regimen for elimination of lymphatic filariasis. For instance, ivermectin targets the parasite's nervous and muscular system, while albendazole disrupts the parasite's metabolism and energy production. To sum up, this case highlights the rare, typical presentation of lymphatic filariasis in 17-years-old who come to the hospital with painless subcutaneous swelling in arms. Although this case is not showing us the typical presentation of lymphatic filariasis, like a fever, lymph node swelling, because infection by parasites sometimes can be asymptomatic or found in atypical sites. This case confirmed that lymphatic filariasis infection by Wuchereria bancrofti. Diethyl carbamazine can also be employed effectively to treat the infection by significantly clearing up the microfilaria. Diethyl carbamazine commonly causes mild and temporary side effects such as fever, nausea, and vomiting. This reaction usually occurs because our body responding to the death of the parasites and often improves as treatment continues.